Welcome to another episode of Higher Learning. I am your host, Oz Rashid. This isn't just a podcast, my friends. It's a front row seat to how elite leaders build iconic teams. The kind of leaders who spot potential others might overlook, who build the cultures people don't want to leave, and who set the bar and then raise it. Work and how we work is evolving at a rapid pace like no time in history. We're going to talk about it a lot in this episode. But our guests will give you insights on how to stay on front when it comes to leadership management, AI, and developing the skills that actually matter. Whether you're a founder, hiring manager, or just obsessed with building the right way, this is your spot. First time here? Welcome. Hit the subscribe button, drop a rating, tell a friend who gets it. To our longtime listeners, we appreciate you and your support. Now let's get into it. Today's guest on Higher Learning, I am joined by Jae Zayed, the Chief Digital and Information Officer at Southwest General Health Center. He's leading the charge on how technology and innovation reshape healthcare. Jay's career has been rooted in solving complex problems with technology, working at companies like Oracle and Cerner over the past decade, where he's built a reputation for driving digital transformation across industries before stepping into healthcare. Since joining Southwest General a little over a year ago, he's been at the forefront of advancing how hospitals leverage technologies to serve patients, clinicians, and communities. And what makes Jay such a compelling leader is his ability to balance the excitement of cutting-edge innovation, particularly AI, with the sobering reality that in healthcare, technology isn't just about efficiency, it's about saving lives. In this conversation, we're going to talk technology and AI, what drew him into healthcare, the current realities of AI in the industry, what's working and what's hype. And he's going to share how he's deploying AI on the clinical side at Southwest General. Jay, that was a mouthful. How you doing, buddy?
Hey, I'm doing well. Thanks for having me today.
You got it, brother. Hopefully I gave you a good enough intro. Hopefully we covered everything there. I want to make sure we spotlight your great career and the great things you're doing at Southwest General. Let's jump into it. You were recently given a bigger title, Chief Digital and Information Officer now. Congrats on that, my friend. Let's talk about that role. Let's talk about Southwest General Health Centers. Is technology something that you were always drawn to, or is that something that you fell into later in your career?
No, I think it was something it's obviously something I was always drawn to from an early age. I'm an 80s baby. I would argue we grew up in kind of that age of technology.
Yeah, I agree. I mean, like when I think back, but the technology is very different now because I remember calling my friend on a landline phone and hoping that they would pick up. There was no such thing as the internet then. We were getting TV and recording with VCRs. I had an amazing Walkman and then Discman. But I agree with you. Like technology was really starting to become a formative part of consumers' lives. And some of us, like myself, and I'm sure you, like to tinker a little bit with some of these technologies and learn how they work. Does that sound like you?
That absolutely sounds like me. I mean, do you remember the old dial-up when someone was using the internet, you pick up the phone, you would cut the internet off. I mean, we went through the true struggles of the kind of internet age back in the early 80s.
Yeah. And I honestly think, everyone's going to say they come from the greatest generation, but I do think that there's some power in living in the pre-internet age and then being in this, abundance of network technology, infrastructure, internet, and AI. But being able to see both gives me a little bit more perspective than I might have had than some of these kids, like my own kids, who have only grown up, right, with digital access and internet and everything in the palm of their hands, like quite literally. So I think that's a benefit to being able to see technology in a very unique and insightful way. You joined Southwest General over a year ago now. I'm interested, what drew you to the industry? And I know you've been in healthcare a little bit previously, but what brought you back to healthcare? What got you excited about this role in particular?
At this point in time, I was actually an executive director of information technology abroad. I was working in Saudi Arabia at this time. The company I was working for had built kind of a hospital from the ground up. Making my transition back to the United States was key. I wanted to make sure that I landed at a reputable organization. I found my way to Southwest General through their outsourced managed partner, which at that time was Cerner Corporation. Made my way. I was brought in as a senior manager into the organization. And really what made me stay, and I had the great opportunity to be promoted from a managed vendor into Southwest General as their CIO. But it was the people, it was the culture of the organization. I always say it needs to be in the holes and not on the walls. And Southwest General exemplifies that in everything that we do. And I think also it's the deep roots to Northeast Ohio healthcare. Being here for over 100 years, you truly see and make a difference in the community that this organization serves.
I love that. And I want to double click on something real quick. You spent some time, it sounds like, in Saudi Arabia in a previous role. You and I both talked about recent visits to Dubai. What was it like,
Uh,
working in that country? Like, I imagine there's so many differences. We could talk about it for days, but just
yeah,
anything that kind of stands out, the differences between Northeast Ohio and Saudi Arabia.
I mean, I think everything, the people, the culture, how they do business, how they do healthcare. And it's interesting because I spent about 10 years in Doha, Qatar prior to Saudi. I mean, the joke was I went from from the kind of iron, from the fire into the firing pan by making that transition. But what was interesting is their ability to excel healthcare, their ability to understand what the art of the possible is and ensure that the country resources, the human capital resources, and where they felt there was a gap, they leaned on United States resources to truly drive to the vision at that time was Sheikh Mozaffar out there. And then obviously Mohammed from a Saudi perspective. So I always, argue or discuss with my counterparts that I was doing these things and not in every minute 10 to 15 years ago, where this technology in some cases is just being made available, being discussed here in the US market.
I love that you said that, the art of the possible. Like I said, recently I went to Dubai. I saw the Museum of the Future. I spent time there. Their ability to build what they've built over the last 15, 20 years is unparalleled. And certainly there's some things that we can be learning from a healthcare perspective in terms of one centralized intent and agenda from the top down to get things done. It sounds like it's given you great perspective. And it sounds like it's from a technology perspective, it's been really, really good for your career.
Yeah, I mean, I'll just say this. How many CIOs get to build organizations from the ground up? Remember, these were greenfield sites. I was there from the first shovel dig. I always say, till we let the doves fly on the opening. But how many CIOs get the luxury of not having to negotiate, argue, or barter when it comes to a budget? Money was not something that was highly discussed at early days in the implementation. So it really allowed our creativity. And I'm going to repeat it again, the art of possible to happen in these organizations, which allowed for just a mountain of innovation that we went through in such a short time.
Fantastic. I love that. All right, let's talk a little bit about AI, particularly in the healthcare industry. I'm interested from your perspective. What do you see as the current realities, both good and bad?
I mean, there's both good and bad, obviously. I mean, I want to talk about the good. It's obviously helping us automate repetitive tasks, surface insights faster, and free up time for staff to focus on higher thought provoking tasks. We're currently seeing gains across reduction in physician times in the EMR, increasing our patient engagement, as well as experience and true savings in human capital as we roll AI out in the multiple places. Now, obviously, when there's reward, there's always risk. I always caution people that hype, don't get caught in the hype. Make sure that we're always solving a true problem. And not every AI tool is ready for prime time in a clinical setting. There are definite risks around bias, privacy, and safety, and these risks are definitely real. Uh, as you know, Oz in healthcare, we can't afford missteps. So governance and guardrails are a must to ensure that we're moving down the innovation pathway safely and respectfully.
I think that's a great call out. There's still, some level of hallucinations and some things that get wrong. I was looking at a bio of me that came off of, I think it was ChatGPT the other day, and it said former college athlete Oz Rashid. Now, those are the type of mistakes I can get behind, although I did not play any sports in college. But I appreciate ChatGPT for thinking that. But you can imagine in a healthcare setting, it's a very different scenario. There's literally lives on the line with that data, with that information. So you have to be smart about implementation. And I know what we're going through in AI right now is you and I are pretty deep into it, and we're seeing what's going on and we're being hands-on with it. We're seeing all the latest innovations. You got to work in it for many years prior to even coming into your current role. But I think the common person, right, is seeing it and saying, God, I read that MIT study where 95% of implementations have not brought ROI, or we're seeing so much investment in data centers and energy, but not necessarily seeing the return on that yet. And you know how this works. It's a technology cycle as old as time. It's the hype, it's the excitement, and then invariably there is some sort of bubble because people aren't seeing the return right away. And then over time, it's like, well, how did we ever live without this? How every part of our life is touched by it. And it feels like we're kind of like in the middle of that right now. What's your thoughts on that?
I absolutely agree. I mean, where is all this power going to come from? You know, as someone that used to work for Oracle Corporation and definitely our EMR is currently supported, it's interesting, amazing to see what Oracle is doing to kind of spread this out across both at the federal level as well as I would call us kind of the local level. But I think I would go back to what I said before. To your point, we can't make mistakes on this. We have to ensure that organizations have to choose the best fit, maybe not best in class, maybe not the shiniest thing on the market, but they need to pick what's best for them, ensuring that any risk that you currently have in your organization is attested to. It's part of the process. Your AI strategy is obviously tied to your corporate strategy. You have great driving strategic principles. You're ensuring that you put a wrapper or responsible AI around it, and you don't move off of that goalpost. And then I think it's obviously having a human in the middle. We're not running AI in itself by itself. We've chosen to buy instead of build, and we want to make sure it's incorporated into existing workflows. So even though we are having a thought partner, we are being assisted by artificial intelligence, we always have a clinician or administration staff in the middle to ensure that before anything is signed, documented, and committed, that human have the ability to course correct anything for you.
I love that. So you know about Moore's law. We know about like how reinforcement learning can make AI become so much smarter, so much faster than any other technology we've ever seen. Let's now look 5 years ahead. Let's say that things start to get figured out, okay, and we start to fix some of these issues. What is healthcare going to feel like from a patient perspective? What are some of the value adds you'll see from AI for a patient just walking into a clinic or needing to get, some sort of health check?
Yeah, I honestly feel it's going to be, and I say this, it's going to be woven into the fabric of healthcare. Patients should feel the benefit and see the true tangible benefits from how their experience is so personalized and it's so proactive, right? Fast forwarding to the clinicians, it should reduce burnout because we're having some of these administrative low think tasks supported by robotic process automation, artificial intelligence, et cetera. A big thing in healthcare right now is ambient listening. It's usually processed off of a cell phone. I see that moving into being built into the four walls of the clinic, where it's just normal practice to have these types of technologies driving patient care, the documentation of patient care. I also think that on the administrative side, prior authorization, claim edits, denials management, et cetera, will almost all drastically be streamlined in the next 5 years, where back office staff obviously won't disappear, but their work will move from clerical tasks to pure oversight.
God, I can't wait for the insurance claims and the payer payees and all that different relationships to be streamlined,
We're all
validated, and all that. That's going to be a great thing, a great day. Um, so I'm interested to know something a little more specific about what you're doing at Southwest General. What are some of the specific AI solutions you're implementing on the clinical side there?
Yeah, so I'll start. There's a couple things we have going on. As I said before, ambient listening, we have call it smart documentation. This serves so many aspects. One, ROI from a physician perspective, he or she can get out on that tea time, make it to his or her daughters or sons recitals, but also having good quality documentation, which will help us from a revenue cycle and a great patient experience. Doctors can now look into the white of eyes of their patients and have a one-on-one conversation without having to worry about remembering and documenting what said patient has said. In addition, it allows patients to talk in their native tongue. We had an example where we had a Romanian couple came in. We had a Romanian doctor. They spoke their entire visit in Romanian, and the AI translated this back into English, back into the medical record. In addition to the ambient listening for physicians, we've implemented something called Dynamet. It's a clear clinical decision support tool. It gives our clinicians summaries, guidelines, and recommendations on conditions, diagnosis, and treatment. We also have rolled out AI in our digital front door, supporting digital arrival, OPAs, and other aspects, which has drastically reduced our no-show and increased our patient satisfaction. We continue to use AI with our CDI team, scraping the medical record and providing feedback to our patients, or excuse me, to our physicians to ensure accuracy of their patient records. We are now embarking on AI-driven radiology and scheduling, as well as pre-authorization. So when the physician places an order for you to come in for a diagnostic test, we have our AI capabilities picking that order up, reaching out to the patient either through SMS or through an AI voice, collecting that information and helping that patient schedule an appointment appropriate. One of the large things we're also working on is using Gen AI to help our physician documentation. We want to drill this down and make this specific to diagnosis into DRG. So when that patient comes in with congenital heart failure, we know that we've provided our physicians with the best tools based upon industry guidelines to document appropriately. And then lastly, we're also looking into, and this is a Q1 thing in 2026, chart and coding agents, which will help our physicians both on the inpatient and outpatient code a medical record and episode to the best of their ability, as well as on the inpatient side, helping our nurses document discrete documentation, reducing the burden that they have, and hopefully increasing patient experience as we can spread some of that resources out more evenly.
Wow. Wow. I mean, if I'm a technologist, I want to come work in your department. If I'm a patient, I want to go to your hospital, your clinic, your center. This is amazing. This is incredible stuff. Like, I didn't expect you to have that robust of an answer for all the different things that you're doing. For anybody wondering if AI is hyper, if it's being implemented accurately anywhere, I mean, you can tell at Southwest General that they're doing some amazing things in this space. Let's talk to our broader base leaders, right? Maybe they're not in healthcare, but they're trying to figure out how they get AI implemented into their organizations, right? Many CIOs and CTOs are dealing with this right now. You're hearing from the top of the organization, we got to get AI, but we need to have ROI. We need to have all, like, it's like a hammer and nail relationship sometimes. And there's many people struggling with figuring out the right ways to implement AI into their business. I'm interested, as the CIO, the one keeping the business of IT and technology running, what are some things practical things that leaders should consider? And what are things that you've done to support kind of the broader business AI wise, maybe outside of the clinician side?
And this may be a broken record, but it's set your strategy. As I said before, we need to pin your AI strategy, your corporate strategy, understand your drivers and have those drivers agree to at the leadership level, embed your strategic principles on how you want to flex this tool sets, and ensure that it's wrapped around secure, risk adverse, responsible AI. Once this is figured out, you have this communicated, everyone's standing on top of kind of these pillars. You're then looking at your governance structure. You know, I always say governance before glamour. How are you going to guide this strategy? What comes in and what comes out? So you have to have a good governance structure. Then there's some key aspects you have to think through. My recommendation would be integration, not isolation. As I mentioned before, you know, we decided to buy, not build, which we feel is reducing our risk. We want to make sure that everything is built within existing workflows, existing platforms, rather than being a standalone tool. And then lastly, on kind of some of the recommendations, it's all about people first. We wanted to set the understanding that AI is about augmenting human capability, not replacing it. So I recommend that you spend time training, communication, and on your change management processes so staff feel engaged, empowered, not displaced, and help you lead some of these projects to their true ROI.
Yeah, I mean, I was going to ask you about, efficacy in the space, getting 100% zero defect rates, but you've already given so many great answers in that space around human intervention and governance and wrapper around, risk aversion and figuring out what you're going to do. If you had to kind of put anything out there and just say, hey, listen, AI is here. Maybe there's people that, are professionals who are concerned or they're afraid or they feel like they're going to get displaced. I imagine change management plays a little bit of a role, at least in terms of people looking at some of the technology that's being rolled out in your organization and wondering, how's this going to impact me and my paycheck? How would you tell people to look at AI, maybe if they're not the leaders strategizing around it? How do you make people feel comfortable about it?
I think I would land completely on the empowerment. Like, these tool sets are here to make your life, my life, the organization, and those that we serve from a community perspective or patient's perspective better, more efficient. You also could, I always talk about what is in it for them. And I always pose my presentations, conversations, and relationship building on what is in it for the person that I'm talking to. Not deviating from that, I feel that I've been somewhat successful, but also I feel maybe a lack of education. So I would recommend that, that you stay curious, you keep learning, and provide some learning and training materials to said individuals so they're on the same page. But you can talk apples to apples prior to any of these engagements, projects, investments, before they go their natural course.
Finding the right talent for your team doesn't have to be a struggle. Meet Aon Hire, the world's first hiring experience management platform designed to transform the way you hire. Powered by AI, Aon Hire takes the hassle out of every step in the process. From smart resume analysis to customized interview questions, it saves you time, money, and effort. Plus, with real-time insights from every interview, you can quickly identify top candidates, reduce turnover, and stay on budget. And forget about note-taking, Aon Hire takes care of that for you. Ready to revolutionize your hiring process? Visit aonhire.com and get started today.
Great advice, man. All right, listen, so you're somebody that throughout your career has built great teams. I'm sure there's a lot of great talent that are just dying to come work with you because of some of the things you said. And you've made an emphasis on people. You've made that very, very important. As much as we've talked about artificial intelligence and technology, you've talked about the importance of people. So I want to get into it a little bit about how you've built some of these world-class teams, the teams that can deliver and execute on some of these different initiatives that you talked about. So let's start here. Do you have a core hiring philosophy? Like what are you looking for when you bring somebody in and they're going to come into your org, your team?
Yeah, it's interesting because if we take a piece out of what we discussed before, in Qatar, I was the director of decision support and data governance, and there were 90 different passport holders in the organization. With my team alone, I had 5 different passport holders. So we were from all different cultures, all different backgrounds. That really made me hone in on what is important to build, not only to the culture of the organization, the microculture that we're trying to build in my team. So to land that, to me, it's all about the dynamic. I ask myself, will they improve the dynamic? Will they hinder the dynamic? And I think that leads me to understand more about their adaptability, the true culture alignment, and honestly, overall attitude as presented through the interview process. And if you take it a step further through that, any kind of communication or extra tasks that you would provide them post-interview as a follow-up.
Thanks for sharing that, Jay. Let's talk about memorable interviews. If I asked you about an interview that either you were interviewing somebody or somebody was interviewing you, that stand out in your memory, either bad, good, we don't have to name names. Can you give me an example?
Yeah, absolutely. So I was interviewing a gentleman for one of my decision support consultant roles. I was in Doha, Qatar. The gentleman was from Lebanon. The gentleman submitted a 12-page CV, 12-page resume. And I think originally most hiring directors, managers, recruiters would probably put that to the side. So I went forward with the interview and I was asking myself, while waiting for us to start, who needs a 12-page outline to find their fit for any role? However, considering the type of role he was interviewing with, the interview actually went very well. The topic of the volume of the CV came up, and he was very eloquently explained why he decided to go the nth degree, which made sense for the role that he's fitting in. And what's funny is, even though it kind of started out on the interesting side, I ended up hiring for the role, and he was actually one of the strongest consultants that I had on the team, which was very interesting. But that always stands out to me because, as you know, with the new hiring process, you submit something, it goes through kind of electronic process, it adds a score. Are you fit for this role based upon what was said? And, this gentleman would have not had an opportunity in that case. So I always lean back on that and always have that in my back pocket or in the back of my mind as I continue to go forward from an interview.
Yeah, listen, this is kind of my wheelhouse. I really care deeply about creating a great interview practice. and process, creating a great candidate experience, maybe make sure that you're supplementing the process with the right technology. You mentioned a little bit earlier about how you wanted the doctors to be able to see the whites of the eyes of the candidates because they're making great eye contact and building a rapport with them. We built software in Aon that does the exact same thing. It allows you to kind of keep the rapport going on and everything's recorded and transcribed with that ambient listening, like you mentioned. So this is something that's really near and dear to my heart. And I think one of the biggest mistakes that happens is people have these preconceived notions, right, of a 12-page resume, or somebody's had 3 jobs in 4 years, or somebody doesn't have this education, and they immediately are looking for short-term heuristics and shortcuts to make decisions. Because of course, if you got 1,000 applicants, you've got to find the shortcuts you can to save time or to maximize your time with the right people. And I bet, and I believe that a lot of really great people get left out of the opportunity to even pursue because people are using these like red marker X's to move through. So major kudos to you, Jay, on going forward with that interview. I might have advised them that I don't believe in the 1-page interview. I think 2-3 pages is good, especially if you have a lot of experience. 12 pages is a lot, but I appreciate you looking beyond that, and look what you got rewarded with, a great hire for that role. So that's fantastic advice and a great example. Do you have a favorite question that you like to ask prospective candidates in an interview? And are you okay sharing it if you do?
Yeah, absolutely. And this has nothing to do, there's no correlation to the role that these candidates have applied for. But here's the question, and we can kind of get into the why. So regardless of the position, I always ask this, and I always wait to the end of the interview after they've discussed, we've had some good rapport and some back rapport. It's quite simple. If you could buy a machine that printed money for life, how much would you pay for it today? That's the question, right? And as you and I know, it's not about the answer. You can always say there's not a right or wrong answer to this, but it is about the journey and how before they get to an answer, what steps did they take? What processes, what questions did they ask before they would throw an answer out during an interview?
So now I'm thinking through in my head how I would answer that question. How much would I pay for a thing that paid unlimited money? And my brain immediately goes to a bunch of questions. One is, how often can I print the money? Second question is, am I competing with anybody else? Because my answer might be $1, right? If I can pay the least amount of money and get the maximum amount of return on investment. What type of money and currency is it? Might come up in my head. It's a really thought-provoking question. So
how much are the materials? Does it run on electricity? What does lifetime mean in this, right? You hit the nail on the head with the questions. It's all about that journey to get to the answer, right? And I think as you're interviewing, this allows people to think on their feet, take some applied skill sets that they've learned, and then apply it immediately on the goal. And I think you'd be interested. Some people would actually say, "Oh, I don't believe in money." And to me, that was red kind of deer in the headlights stuff. And that's just not in technology where we are. We get business requirements, we get problems thrown at us left and right. And, in my mind, we have to be nimble on our feet and ready to act at all times.
yeah, so I just have thought about my answer now that I asked, because I always want to ask questions before I get to my answer. And then my thought went to, how much collateral do I have? How big of a line of credit could I have? I go to a bank. I'll make sure that they get paid interest on it. I get some profitability out of it. And that is probably my answer. What's the biggest line of credit I can get if I had to pay the maximum amount? Well, it sounds like I'm hired. I'm going to be starting at Southwest General in a couple of years, guys. So thanks for having me. All right, let's talk about this. When you miss on somebody, because we all miss, is there maybe a theme that you look back on something that you wish you would have done differently, or maybe something you learned throughout your career of interviewing that you fixed as time has gone on?
Yeah, you already took the crumbs there. So you don't always make all the shots you shoot, right? I think we've learned that from the greats, Michael, Kobe, etc. I fell into the trap. I have a void I have to fill. Someone has left. I have short term to turn this around. The individual was a project manager that left, and I had 62 things that were currently moving forward. So I just needed someone to come in, pick up where the other person left off, and drive things forward. But to our point earlier, I was more geared about the functions of this person in the delivery aspect versus ensuring that when they did come to the organization, were they a good candidate for my team, and were they a good candidate for my client? And lessons learned on that was continue to stay rigorous, continue to stay consistent on the goal and the approach of hiring when selecting candidates, regardless of the situation.
Very good. Love that. What about if you have a frustrating piece of the process? Is there something about the hiring process that you wish if you could fix with AI, or maybe a flick of your fingers you could change? What's something about the current hiring process, whether it be from the candidate side, it be from the hiring manager side, that is something you wish you could change?
We've talked about the intake process, like positions posted, announced to the world. How do I filter out? I think even after that spot, have the interview, I've been selected, the bureaucracy that I've seen, and I've worked from some very large corporations, but tech, things moves fast. We need to be able to identify a candidate, have a conversation, build rapport, select a candidate, and get he or she into the organization as fast as possible. Some of the red tape processes, I would say, are great. And I understand from a business perspective why they're needed, but we lose out on great candidates. So that has been somewhat of a frustrating part for me. As I tried to build, as you've put, kind of world-class teams in my career.
So I want to ask you, I usually ask people around this point around how they're leveraging AI in their job. We've already talked a lot about that. So let's
Yeah.
kind of from a personal perspective. How are you using AI to enhance your life personally?
Yeah, I mean, you see me, these are AI glasses. Instead of an Apple Watch or consistently looking at my phone, I get real-time updates at any given time in my glasses. I'm able to reach out to Perplexity or ChatGPT. I'm able to navigate with my glasses, translate, teleprompter, many different techniques. I'm someone that doesn't want to talk about AI. I want to walk AI. So that's kind of the fun perspective. But you could argue I use AI almost every day as a thought partner, as a thought leader, someone that I can put something together, bounce it off my thought leader. I call Jada, he's digital assistant, and to be able to get great sound feedback. In addition, AI is helping me take meeting minutes and notes. I have my virtual assistant on at all given times. And if needed, I'm able to go back to discrete point in time for detailed documentation that makes my life and my executive assistant's life that much easier. Talking about it, how I manage my teams, we've rolled out M365, which includes Copilot. I'm using it to help with email communications. If I want to go and jump into a policy, I can quickly just pull up the chatbot. It can go straight where we hold our policies, give me quick and immediate feedback. If I'm searching for a number or an email, I just throw it in there and ask for that person, and it goes out and scrapes it and pulls it in. But I think in most places, from an administrative perspective, from a thought leadership perspective, and an overall efficiency perspective, AI isn't embedded in the things that I do on a daily basis.
Has that glasses in any way helped your ability to answer these questions? Did you get any bit of advisement?
No, the glasses are in silent mode. However, I will tell on myself and said I did use the teleprompter capabilities at one of the board meetings to give a presentation just to kind of prove a point. And I will say it went over very, very well and kind of resonated.
This is fantastic, but this is discrimination from somebody who has 20/20 vision. I can't wear these glasses. I want these.
The lenses are not prescription. They're just lenses. I'm using it more for the capabilities than anything.
Oh man, that's amazing. All right, now I'm gonna get some really be like, man, what happened? I'm like, well, you know what? I'm living in this AI world, baby. Jay, that's amazing. I gotta ask you, have you read any good books recently that you'd recommend for our listeners?
Yeah, I mean, this is a little bit old school. Power of Habit, Charles, I think Duhigg read it. It really opened my eyes to behavior, and both individually and organizationally, and the habits that come from that behavior. And I think in my small mind, as we try to roll out AI, it breaks the fabric how we puzzle pieced healthcare together. And I think we need to understand those habits. And when change comes, how we can kind of course correct or add new habits as the technology takes over more the capabilities from our workforce as well as from our clinicians.
Good stuff. Do you have a favorite product that you've recently purchased that you want to share with everybody? Outside, maybe your last or even AI. Is there something the product that you just love?
I wouldn't say so. I mean, me personally, there's not a particular product that I can say I'm absolutely glad that I've purchased this. I think with some of the investments on the healthcare side or the organizational side, I'm very proud of some of the purchases that I mentioned before that.
Look at that. What an answer. All right. What about some advice you give your 20-year-old self that you didn't know then, but that you know now?
Ah, don't rush. You don't have to have it all figured out. Most important thing is resilience and building relationships. Those two things to me are very high valuable skill sets. Continue to focus on curiosity, adaptability, and integrity. And I think a lot of the other things would fall into place.
Love that. All right, we're going to go into a quick lightning round. Of course, people who listen to this podcast know I'm going to probably ask you about Saudi Arabia, UAE, and Dubai. So let's do that real quick. What's something that would surprise people listening to this about being a professional in any of those areas?
Good question. I don't know if it will surprise anyone. I don't think there was anything that was, outlandish about this conversation. But if I would say one thing to surprise them, I would say, don't always overload your best individuals or your best performers with more work. I think they deserve to have freedom from that work to be even more creative and to help other teammates improve workflow processes, etc.
Love that. From personal life aspect of living out in those areas, because you spent, it sounds like, more than a decade out there. I'll give you an example of one that stood out to me. When I went to Dubai, I felt like there was, the example I've used is not a perfect analogy, but when you visit Miami, it's obviously an American city with like a Latin undercurrent. And when I went to Dubai, there's like an Arab undercurrent, but it feels like a very cosmopolitan city that's really going out of its way to cater to multicultures and to make Europeans fit in and Asians fit in, Americans fit in. I was amazed by that. And it's also the safest place I've ever been, ever. Like, apparently, like, you could just put your laptop down at a table for 10 hours, come back, and it would be sitting there,
It'll still be there.
right where you left it. So what's something about, you lived out in those areas, what's something about the personal life out there that might surprise some people?
I think the personal life, if I kind of try to put the context around it, would you believe that most all patients know their medical record number? When they come in, they check in with their medical record number.
Wow.
And if it's not their medical record number, it would be their telephone number. I think the consumerization and their ability to truly protect first as a driver versus enabler is what really was eye-opening for me when I had the opportunity to work there.
Love that. Of the cities, of the areas we named, right? There's Doha, there's Dubai, right? There's Riyadh. Where would you live for the next decade?
My gosh, I would definitely live in Dubai, but to me, that's kind of a weekend thing. Come in with the family, have a good time. I would even throw another curveball out to you. I would pick to live in a little island called Sri Lanka. It's the teardrop of India. There's a little beach called Unawatuna. I would recommend everyone get the opportunity to fly into Colombo, take the 2-hour drive down there. You will be very happy that you did.
By easily the first Unawatuna reference we've ever had on the podcast. I love that. Last one. What is your preferred airline to fly out there?
Qatar Airways, hands over. You got to ride Q Suites. If you're riding right, you're flying Qatar Airways.
Now, I got to be honest. I'm an Emirates guy. I had a really great experience at Emirates. Where does Qatar Airlines stand out to you?
They stand out in service. They stand out in cleanliness. They also stand out in, you've heard of the Q Suites, right?
Plus the Q Suites.
The Q Suites are phenomenal. I have a family of 4. We're all able to close the doors up around us and have face-to-face conversations over a small little table with obviously all the audio-visual aspects that you need to have a safe journey. And as you can imagine, and as you know, taking a 17 to 20-hour flight, you want to be absolutely as comfortable as possible.
100%. Wow, I didn't know that. Never heard of the suites. Obviously, Emirates has many things that's great about it, but I don't remember seeing any family suites. And listen, I follow a lot of, English Premier League soccer. They're sponsoring teams with, Manchester City and Arsenal. Guys, Qatar Airways, if you want to go ahead and sponsor the Higher Learning Podcast, let me know. We are available. We'll get you right up there on the tagline. Jae, You've been amazing. I appreciate you coming on, man. I learned a lot talking to you. I know our listeners are going to do the same. Thank you so much for coming on.
Thank you, Oz. It was a pleasure.
All right. Appreciate it.